most grateful if you could turn off your phone into silent mode for those who are in the hall. Kindly stand up at the arrival of our Deputy Vice-Chancellor of Development, Prof. Insignio Dr. Ramesh Singh, and Professor Dr. Azlina Amir Abbas, and also when our national anthem, Negaraku, and song are played. Please stay back for a photo session after the lecture. Your cooperation is greatly appreciated, and your participation is very welcome. For those joining us on YouTube, we invite you to leave your greetings and comments in the comment section. We will begin shortly. Thank you. Ladies and gentlemen, I would like to welcome the arrival of our Deputy Vice-Chancellor of Development, University Malaya, Prof. Insinyur Dr. Ramesh Singh, accompanied by the Honourable Professor Dr. Azlina Amir Abbas, Faculty of Medicine, University Malaya. Can everyone kindly stand, please?
Universiti Malaya, kebanggaan kita semua, bertambah para ilmuwan di berbagai lapangan. Kami bertekad di hati mencapai cita murni, tradisi kecemerlangan menepati kesayanganku, sungguh banyak jasamu membentuk insan mulia, berilmu berbudaya. Di sini kami sedang berbakti, terus berinovasi. Kami harapkan generasi muda teras nusa dan bangsa. Varsity kesayanganku, sungguh banyak jasamu membentuk insan mulia, berilmu berbudaya.
If I may invite you to take a seat, Professor Insinyur Dr. Ramesh Singh and Professor Dr. Azlina Amir Abbas, along with the audience. Pantai sepi, alun berlagu, burung camar terbang seiring, segenap hati menuntut ilmu, menuju kejayaan bersama mengiring. Selamat sejahtera diucapkan kepada semua hadirin yang dihormati sekalian. Selamat datang ke Syarahan Perdana Profesor Dr. Azlina Amir Abbas pada hari yang berbahagia ini. Izinkan saya untuk bertutur dalam bahasa Inggeris untuk sama-sama meraihkan para hadirin dari luar negara. Ladies and gentlemen, I would like to extend our warmest welcome to Yang Berusaha Professor Insinyur Dr. Ramesh Singh, Deputy Vice-Chancellor of Development, University Malaya, Yang Berusaha Professor Dr. Azlina Amir Abbas, Professor of Orthopedics, Department of Orthopedic Surgery, Faculty of Medicine, Yang Bahagia Professor Datuk Dr. Yang Farida Abdul Aziz, Dean, Faculty of Medicine, University Malaya, and Prof. Yang Berusaha Professor Dr. Nazira Asnan, Director, University Malaya Medical Center, Distinguished guests, professors, doctors, ladies and gentlemen who are joining the inaugural lecture virtually and physically today to this very special event hosted by the Faculty of Medicine, University Malaya. I would like to invite Dr. Khairul Anwar bin Ayub to lead the Dua recital.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Ar-Rahmanir-Rahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Amin. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala Sayyidina Muhammad ashrafil mursalin wa ala alihi wa sahbihi ajmain. We gather here today in gratitude for your greatest blessing upon us. As we come together for this event, we seek your guidance and support. Ya Allah, grant us the strength and courage to overcome the challenges in our pursuit of knowledge. Bless us with wisdom, clarity of mind, and resilience of spirit. Bestow upon us good health, both physical and spiritual, inner peace, and unwavering determination. Ya Allah, strengthen our teachers and leaders so that they may continue to serve with wisdom and dedication, guiding our communities, our nation, and our faith towards a better future. Ya Allah, make our country a land blessed with your grace and favor. Grant us lasting peace, unity, and prosperity for generations to come. Let righteousness and justice prevail, and may we always be guided by wisdom and compassion. Amin, amin, ya Rabbal Alameen.
I am Devrani Pancharatnam, and I'm honored to be the Master of Ceremony for the inaugural lecture of my inspiring lecturer and colleague, Prof. Azlina Dr. Amir Abbas, who have profoundly shaped not only my journey, but the field of orthopedics. An inaugural lecture is a ceremonial event that celebrates a professor's achievements and research at a university. It is a significant milestone in the academic career of a professor and provides opportunity for them to share their wisdom, inspiration, and philosophy. It is one of University Malaya's cherished tradition. We are grateful today as an audience for this inaugural lecture by Professor Dr. Azlina Amir Abbas, a committed and enthusiastic professor of orthopedics, Faculty of Medicine, University Malaya. Today, Professor Dr. Azlina Amir Abbas will be sharing her journey in the field with us in this inaugural lecture entitled Advancing Excellence in the Hip and Knee Arthroplasty, Innovation and Best Practices. Ladies and gentlemen, without further ado, I would like to invite the Deputy Vice Chancellor of Development, University Malaya, Prof. Insigne Dr. Ramesh Singh, to chair the lecture and subsequently introduce Professor Dr. Azlina Amir Abbas. Please welcome.
Thank you. Good afternoon, everyone. It's a pleasure for me to be here this afternoon to chair the inaugural lecture by Professor Azlina. My name is Ramesh. I'm the Deputy Vice Chancellor for Development. Dato Sri Naib Chancellor, he sends his warmest regards. Unfortunately, he's not able to attend this inaugural lecture. Actually, he told me that for all inaugural lecture, he would like to attend personally to introduce the speaker. But this afternoon, we had important guests from outside, and there's a discussion, and so for that he has asked me to fill in the gap. So he sends his warmest regards. I know Prof. Azlina for some time. She's the Deputy Dean for Development, so she looks after all development projects in the faculty. Since I took over office as the Deputy Vice Chancellor for Development, all the Deputy Dean Development of all the faculties, they work closely with me. They oversee all development projects. So I can say without reservation that Professor Azlina is very committed, besides doing her normal duty as a surgeon, as an academic, but she's very committed as a Deputy Dean Development as well. She looks after all projects within the faculty, and She makes sure that everything moves according to time. Any delays, she would disturb me, disturb my office, disturb the facility department to ensure that everything that she do is in the best interest of the faculty and of the university. So it is really a great pleasure for me to be here to introduce Professor Dr. Azlina Amir Abbas. Foremost, I think I'd like to say good afternoon to everyone. I probably missed that part in the beginning. So welcome to this inaugural lecture. Okay, ladies and gentlemen, it is a pleasure to introduce today's esteemed speaker. Her CV is quite lengthy. So I have to make sure that I get all the necessary points, so bear with me as I introduce the speaker. It's my pleasure to introduce Prof. Azlina. She's a professor of orthopedic surgery at the Faculty of Medicine, University Malaya, and a key figure in the National Orthopedic Center for Excellence for Research and Learning, NOSRL. Specializing in hip and knee replacement, musculoskeletal infections, and regenerative medicine, she has been instrumental in advancing orthopedic care in Malaysia. Professor Azlina's journey in medicine is deeply rooted in her family legacy. She is the daughter of Amir bin Abbas, a general physician and the first dean of the Faculty of Medicine at University Kebangsaan, Malaysia, and Rosana Bang Chin Leng Abdullah, a pharmacist. Prof. Azlina pursued her early education at SRK Asunta, SMK Sri Aman, College Tunku Kursia, and College Tunku Jaffa before earning her medical degree from the International Medical University IMU and Memorial University of Newfoundland, Canada. Her career in University Malaya spans over 2 decades, where she has contributed immensely to medical education, research, and clinical advancement. She has served in various leadership roles, including Head of Department of Orthopedic Surgery, Deputy Director of NOSRL, and currently as Deputy Dean of Development and Infrastructure at the Faculty of Medicine. Her dedication extends beyond academia, as she has played a pivotal role in national medical curriculum development, postgraduate training, and policy making in orthopedics. A passionate advocate for innovation, Professor Azlina has been at the forefront of introducing robotic knee arthroplasty and daycare knee replacement services at Medical Center, UMMC. Her research collaborations, publications, and leaderships in professional society have solidified her reputation as a leading expert in hip and knee arthroplasty. Today, she will share her insight on advancing excellence in hip and knee arthroplasty, innovations, and best practices. Please join me in welcoming Professor Azlina Amir Abbas in delivering her inaugural lecture. Thank you.
Okay. All right. Thank you, Prof. Ramesh. Assalamualaikum, good afternoon, everyone. It's really nice to see everybody here, some of whom I've not seen for a very long time. So I'm really glad that you could make it here today to celebrate this very special occasion with me, the faculty, the university, and my family, most importantly. So the title of the talk is what ChatGPT told me would be good for an inaugural lecture, which is Advancing Excellence in Hip and Knee Arthroplasty. And a lot of people will ask, what's arthroplasty? It's generally Greek for the layman term joint replacement, where we commonly replace damaged joints and put in new implants so that patients can move again. It's commonly performed for patients with osteoarthritis. And when you try to explain to patients what is osteoarthritis, cartilage wear, they can't imagine it. So normally the analogy I always use for patients is, imagine your knee is a car tire. When you're born, it's a very nice tire, bunga still there, and every day of your life you've been walking, and slowly the bunga will fade, and then it will be worn out, and tire sudah jadi botak. And if you're lucky, you can do a joint replacement at this point. If you're very unlucky, you're driving rims on the road, you really need a joint replacement at this time. And for all intents and purposes, patients kind of understand the analogy, male or female, everybody understands car tires. Now, for the students here, this is all that is factual and scientific about this lecture. It's not a conventional lecture where I will tell you about things you need to know for your exams and what have you. So this is it. If you're disappointed, I'm sorry. You can leave the hall now if you want to, but I hope you do stay on. And it's really a talk to share with you my journey as an orthopedic surgeon. I hope at the end of it, I know the usual thing people say, like orthopedic surgeons, they're like carpenters, they hack away at people's body parts. I hope at the end of this lecture, your image of me is not like this, okay, and that you will understand that I'm more caring than this model here. And it's really my journey to how I became an orthopedic surgeon, okay. That journey has to start, obviously, with my parents. So the picture on the left is the earliest known picture of me. I was only a couple of months old, in sleeping very soundly in my mother's arms. And those who know me will know that sleep is very important to me. So obviously, I carry that from birth until now. My mom and dad are alumni of UM. Dad graduated MBBS, UM Singapore, and mom graduated as a pharmacist in UM, also in Singapore. So I guess it's not shocking that I'm here if I have alumni for parents. The handsome young man standing to the right of my mom is my eldest brother, Zaf. And as you can see, the gap between my eldest brother and myself very large, about 6+ years. But the gap between me, my younger sister, who's seated next to my mom, and my younger brother is only 1 to 2 years apart each. So the three of us were closer than the elder brother, who is a bit further away from us. That's us growing up. These are my grandparents. To your left is my paternal grandparents, and to your right is my maternal grandparents. I put this here really, it's sort of a reminder to me, and I hope you get this as well. But it's to show and remind me the value and the sacrifices that our grandparents, our great-grandparents, our ancestors have done for us to guide our parents, to guide us to be where we are now. All right? I never knew my late grandmother. She passed long before I was born, when Dad was still studying in University Malaya. But I got to know my grandfather. He was a tailor, selling songkok and chapal in Main Street Bazaar in Kuala Kangsar. Yeah, that's how far we came. My maternal grandparents used to run a liquor shop at Main Street, Kepong. And one of the earliest memories is the long drive to Kepong from PJ, because the drive to Kepong is nothing like what it is now. There was no IKEA, no Damansara Perdana, Damansara Mutiara, what else? Desa Park City, Bandasri Damansara, all that tak ada. It was all estate land with a large quarry smack in the middle of the road, so which we had to drive around. Going through school, I spent my primary, you heard from Prof. Ramesh just now, in Asunta Primary, and moved to secondary in Sri Aman. For those of you from PJ will know, Asunta and Sri Aman don't mix. Siapa Sri Aman here? Okay, 1, 2, 3. Asunta? Tak nak mengaku. Okay, oh my God, Teva, sorry. So in PJ, we are mortal enemies, these two girls' schools, right? But one of the primary reasons moving to Sri Aman was just 400 meters from our house. 400 meters, which my maternal grandparents insisted that we had to be driven to school, that we shouldn't walk. That's how much they loved us. To my parents, horror, it's like, you're spoiling them. So I was in Form 1 to Form 3 in Sri Aman, and moved to boarding school in Form 4. The picture of the three of us there, Azima on my left, it was the first friend I ever made in TKC. Hazel on my right was my best friend actually in TKC. So with them and Afida, who was my junior, I think that's how I survived 2 years in boarding school. After SPM, I jumped from one boarding school to another boarding school, and this was College Tunku Jaafar in Mantin. We were the first pioneer batch. It was a brand new school, so brand new, they were still fixing up stuff when we moved in. As sixth formers, we were the abangs and the kakaks in the school. We had to guide the juniors. The intake was pretty small. I think it was only about 100 something, and everyone knew everyone because it's not difficult, because they put us all in the same boarding house. It's one boarding house with 4 sides. One side is girls, 3 sides is boys, with only grills to separate the two. They soon figured out that was not a good idea, and by the next year, there were 3 new boys' boarding houses for the boys to move out to. But KTJ was where I had my first taste of a leadership role, because I was made head girl then. And it was there that I learned, having a leadership role comes with a lot of responsibilities. It doesn't mean that you're the boss now, you can do whatever you want and impose a different set of rules to everybody else. I have been back to KTJ since. They've invited me, especially in the last few years, to do career talks. And following those talks, we've had a number of students come to do shadowing and attachment here in UM. And I received good news a couple of weeks ago from one of the kids who shadowed. He's been offered a seat in University of Edinburgh to do medicine. So it's really nice to be in touch with the younger generation. I feel so old when I say that. So moving from one brand new school, when I finished my A-levels, I moved to another brand new school. IMU back then was called International Medical College, and we were the first intake. We were very commonly called the guinea pig batch. But we felt nothing like guinea pigs, actually. We had a really good time. If that's what guinea pigs live like, I think I don't mind being a guinea pig all the time, because we really had a lot of fun. And our first intake was in November 1993. For the surgeons out there, the gentleman seated on the left, the second one is Sir Patrick Forrest, a very eminent breast surgeon, and I think he took some time in his senior years to come and spend it with us in IMC. Next to him is Professor John Beck, who was the dean of the school. And on the other end, the young lady you see there, seated there, is Miss Mei Ling Yang. She unfortunately has passed a couple of years back, but seated next to her and who is here today is Professor Ong Kok Hai, who was Deputy Dean of IMC at that time. And he was the one who interviewed me when I got into medical school. I really struggled to reach that stage in medical school. I had to resit my A-levels again. And I remember when I interviewed him, the thing that he said that stuck to me even up to now: Azlina, I think you're a really good fit for this university. We're going to take you in, despite him having had to do, repeats. But the next thing he said was really stuck to me. I'm taking you in not because I know your father. It's because I think you can do it, and you are going to be of value to the profession. And that really meant a lot to me, Prof. Ong, so thank you very much. Because when you're young and you struggle, you start to get a lot of self-doubts. And you need some validation from people outside who tell you that, hey, actually you're not that bad. You're just going through a bump, and you pull through. Again, we celebrated our 30 years 2 years ago, 2023, and I've been back to the university also as external examiner, etc. Okay. So back then in IMC or IMU, they didn't have a whole local medical program. You had to go overseas. So my partner university was Memorial University of Newfoundland, Canada. In 1996, we went, 5 of us from IMU or IMC. Again, guinea pig batch, because they had never received foreign students before, much less from Malaysia. So the 5 of us, we were glad for each other's company. The university is based in the beautiful city of St. John's, Newfoundland. I was taught to say Newfoundland, it's not Newfoundland. When we were learning in geography, dulu, we were told it's Newfoundland. And the only thing we knew at that time about Newfoundland was it was very famous for fish, for cod fishing. But when we arrived in 96, actually the whole province they had stopped fishing cod because they had overfished. So there was a moratorium on fishing, and literally they were in recession. You could see a lot of shuttered shops. The more younger productive middle-aged group would be in the mainland, leaving mostly elderly and younger population left in St. John's. But it was a really nice experience. People there were really friendly. The way they speak is like a mix between Irish and English and not like North American English, and I really enjoyed it over there with the five. You see only four of us. The snowman is the stand-in for the fifth person. Okay. I graduated in 2 years, and with all my struggles in IMU in the first 2 years, getting through every systems, right? Everything somehow fell into place when I was in Canada. And I think it's not because Canadian teachers were better than the Malaysian teachers, but it really was because this is what I learned about myself. The way I learn is I need to see the bigger picture. You cannot just throw a chapter at me, study this, read this, and understand it, and pass your exams. I needed to see the patient. I needed to do the palpation, the auscultation, everything for me to understand. And really, that 2 years was very eye-opening for me, and it allowed me to be where I am today. Taking the photo with us in the bottom left picture, that's Selma, my other classmate. She's now an ONG specialist up north. But the gentleman standing next to her was our dean, Dr. Ian Bomer. The first time I had heard of an infectious diseases physician consultant was Ian Bomer. And we were talking infectious diseases, and we didn't know what it really was. But now I realize the value of it, and hopefully you understand that as I go through this talk. For the graduates of UM, be thankful your graduation is not so like this. For the dean also, I think you must be thankful, because for every graduate that went up on stage, you had to kneel. And the dean would have to sarungkan the hood over you. So that's what Prof. Bomer was trying to do while I was trying to kneel on the stage and then get up. The chancellor actually don't need to do anything. So I think in UM, I'm not sure, Prof. Ramesh, you want to suggest something like this for our graduations? I think our pro-chancellors and all might be happy for this. So I graduated in April of 1998, and I really took my time to come home, almost 6 months, traveling, because I knew that once I came home, once I started work, that's it. There's no more holidays for you. So I took almost 6 months to come home, and I took my own sweet time to apply for housemanship. These days, I understand applying for housemanship takes months. At one point, it was a year. At that time, if you apply within 2 to 3 months, you would get your posting. So lo and behold, I got housemanship here in UM MC in December of 98. That time, housemanship was only a year, so I did the 3 compulsory postings, which sounds like what you guys are going to do in the future, because that's the way things are moving to now. So I started with medicine, surgery, ONG, and then I requested for an extension of 6 months to complete the other 2, because we were allowed to do that. You had that option to extend, where I did pediatrics and orthopedics. The work that I did as a houseman, the reason why my clinical clerk card is there from my medical school, because all the work that I did as a houseman was exactly the work I did as a medical student in Canada. I was embedded within the clinical teams. Wherever the team went, that's where I went. If they were in OT, I went to OT. If they were in clinic, I was in clinic. If they were on call, I was on call. And I would be the first one to see all the patients, examine, discuss a plan, etc. So housemanship for me, I'm sorry to say, was a bit of a no-brainer, because I had already done it for 2 years before. So feeling restless, as I always am, I did more things. So on the side, I used to do other stuff. So when I was in ONG, apparently someone noticed, wow, you can type very fast, huh? And in ONG, I don't know whether that's the same now, but they had to do 10 short case write-ups for obstetrics, 10 short case write-ups for gynecology, and 1 long case each. So that's 12 write-ups. And this particular MO had not done 1. He had handwritten something, but he had not done 1. He goes, Azlina, can you type? And within a month, safe to say, he passed his thesis on time due to my typing skills. So much so that his friends were jealous. So some of them would, also commission me to do some typing for them. Now, when I finished medical school, actually, just as I'm sure all of you will for medical students, and all of you did for the medical officers, you have an idea of what you want to be, right? Based on medical school, what you've been through. And my top 3 choices were general surgery, obstetrics and gynecology, and pediatrics. Those were my top 3. As you can see, I didn't follow my top 3. That stint with typing for obstetrics and gynecology really shifted me from general surgery to obstetrics, because I go, wow, so easy, just deliver babies only. Just deliver babies only. And actually, when I applied for a trainee lecturer post here in UM, that first application was for ONG, all right? But as fate would have it, I finished my housemanship with orthopedics, which my MOs at that time told me, it's the best posting to finish with because it's a vacation. You can just chill and relax. Ortho is so chill, said the general surgery MO. But I stayed in ortho actually for almost 9 months because I completed my 3 months posting, then thinking what I wanted to do, applications, etc. So delay. I ended up in ortho for about 9 months plus. And during that 9 months, something changed because although technically I was labeled a houseman, after 3 months, I was allowed to do MO stuff. MO call, of course, under supervision. I went to clinics. I was with a team. And I started to see how amazing orthopedics was. It was really, ignorance is bliss lah, because I would be assisting Dr. Jamal to do arthroplasty. And from my end, who don't know anything, thinks that all you have to do is just stick some stuff there, which will tell you where to sew. And I was like, wow, that's the best job ever. And little did I know that actually it's more than just sticking stuff onto bone. So with that, with one month or 2 weeks before my interview, I went to Dean's office and said, can you please switch from ONG to orthopedics for me? And I remember when I went for my interview, sitting outside the Dean's office, Prof. Kula was inside the bilik mesyuarat, and I could hear him, what? She changed? And he come out, which one of you switched from obstetric? I was like, me. But really no regrets, and I think we're all good now. Prof. Kula and I have made our peace, so not to worry. So as trainees, Azura and I were in the same batch. And we started our masters in 2001 and finished in 2005. I did a lot of stuff in masters, not just the things that we expected to do. In 2004, Prof. Kwan and Prof. Chun apparently felt that I had a good voice. So I was commissioned to do teaching videos for the department, for the training course. That's the OTC cover. And it really showed me, one, if you are a really good surgeon with good hands, as Kwan is, how beautiful it will be at the end. That's number one. Your attention to detail, that's what I learned from Kwan. I'll spend 2 hours. That time it was the old Apple, the old Mac with the circles of death, the colorful wheel of death that will turn for 3 hours and nothing will happen. And after so much difficulty, Kwan says, Azlina, very nice, very nice. Can you put a comma there? Another 3 hours. So that was how perfectionist Kwan was. But I understood where he come from because, the end product looks really good. I probably got a lot of nasty talk because I would be in Prof. Chun's office from 6 a.m. to midnight with Prof. Chun and Prof. Kwan. What was this girl doing in the middle of the night, day in, day out? And it was intensive 1 month of preparations for the videos and the manuscript. But I learned a lot from that. From that, apparently word got around that Azlina is really good with computers. So since then, every conference or course, apparently I'm in AV. That's the reason for the second photo at the bottom with the mic, wireless mic there. We were at a conference at one time. Our batch was the largest batch in UM at that time, at 13. Currently, we're taking 20, so that's nothing now. And our batch was also the batch with the most number of girls at that time, which were 3. This year, well, the last intake, I think we took about 7 or 8. Almost half the intake for Auto Masters last year were actually women. So when I finished my master's, I spent 2 years in arthroplasty training with Prof. Chun before going off to South Korea in 2007 for a 1-year fellowship in hip surgery. At that time, I had only been married for 9 months, so I spent more time away from my husband than I had with him after our marriage. The picture at the top that you see on the left is with Professor Teck Rim Yoon. He was my supervisor, very nice man, very fatherly. He really took good care of me. I think it helped that he had 2 daughters of his own, so I think he knew what it was like for daughters to be away and how my parents would be worried about me in a land that is so far away from home. He was caring enough that before I arrived, he had arranged girlfriends for me. So the spot the Malaysian photo, when I arrived, within the first week, he says, Azlina, there are 3 Korean doctors here who want to learn English. Can you teach them? I said, okay, sounds good. So he introduced me to them. And when we first met, and he left us and walked away, and we talked. And it turned out he told them I wanted to learn Korean. So that's how we ended up together. And they did teach me some Korean. I can read. Like the Korean up there, it means Abbas. Abbas, my name. I can read, don't ask me to translate. Okay? And actually these 3 ladies, they were consultants in radiology, dermatology, and dentistry. They were my lunch buddies every week for the whole year. The hospital that we were at was a relatively new hospital. Chonam National University Hospital actually reminds me a lot of PPUM. The main hospital in Gwangju City is like PPUM. You have that plot of land with all the high-rise, and they couldn't build anymore. So what did they do? They built another hospital off-site. And this hospital was about 30 minutes away from the main city. It helped that it doesn't have the traffic like KL, so it wasn't very difficult to go. It's the closest I've ever been to kampong life, because as you can see, surrounding the hospital were paddy fields, and behind the hospital were hills with trails, where it's not uncommon to see patients walking with their drip stands up the trail. Right? So Koreans are really strong. That's the other thing that I learned when I was there. The hospital was primarily an elective knee and hip hospital, but it was also an oncology center. So most of the patients there were actually oncology patients. That's in the middle of the hospital in autumn, I think. In end of summer. And the bottom photo is the hospital in winter. When the first week I was with Prof. Yoon, one of the first things he said to me was that, Azlina, do you know why I took you in? I said, no, not really. And he goes, it's because number 1, you speak well. So, you do a lot of writing for us. They have a lot of data, and they needed someone who could help publish it for them. But his second reason was very, inspirational to me in a way. It was because he said, because you're a woman. And I need you to motivate our women medical students to take up orthopedics. So after I left, I think a couple of medical students did try, and they did, I think the few that have graduated since then. So I'd like to think that I had some role to play with that. My stint in Korea actually earned me 6 ISI publications in 1 year. So when I came back, it really helped me with my promotion exercise. So the hospital was so new that when I arrived, there was this wall where they put all their staff photos, and my face is there. So Prof. Yoon says, you are here forever, you are tied to us forever. And actually, he's right. I have been back actually, every year, every 2 years, because Prof. Yoon runs a hip workshop where he invites all his past fellows to come and give talks and share, what they're doing now. The last time I was there, is the bottom center photo, was for Prof. Yoon's retirement, and that was last year. And again, this photo to me is very meaningful because in a Korean society, where am I sitting? I'm sitting in the center. The first row are all the senior academic staff. Prof. Kwan knows Professor Chung, the spine surgeon. And they made way for me to sit not just in the front row, but also in the center. And to me, that was really a great honor for me to receive this type of recognition from my colleagues in Korea. The two gentlemen at the side, my younger brothers when I was in Korea, really looked like adik-beradik lah kan. All right, so I came home. I became associate professor in 2010, and I became a full professor in 2015. And literally what I do is joint replacements. When we show knee replacements to patients, they always think that we chop off half the femur, half the thigh bone, and half the shin bone, and replace the whole lot. But actually, this photo is meant to show you that only trim the ends only, and then we cap it with implants. Metal on the top, metal at the bottom. Metal and metal was scratched, right? Not good. Yes. Okay, so put plastic in the middle, and that's a knee replacement. I didn't put the surgical photos for those who are squeamish. So as part of my dissertation in master's was really looking at the outcome of knee replacements in our practice. And in 2004-2005, our outcome was pretty good. 98% of patients said, yes, really good. We would recommend it to others. No more pain. I can walk. I can do whatever I want now. But out of the cohort of patients, 16 said, if I had a choice, I don't want to go through it again. Why? And actually, a lot of them say the number one reason is because the post-operative pain, which at that time, in the early 2000s, we were only giving, I think, paracetamol and petidine maybe. That's it, 2 types of painkillers. So 16% said the pain was unbearable. I don't want to go through it again. It's worse than childbirth. No way, Jose. Thank you very much. So it set out to us that obviously there were things for us to improve in our practice. And one of the things that we tried to improve on is how to optimize our waiting list, our operating list, as well as the patient's health and well-being so that they can undergo surgery and recover smoothly. At that time in 2005, there were only 3 arthroplasty surgeons. I was in training. Prof. Chun was the head of the unit, and in the middle photo was Dr. Vara. I think the senior ones will know Vara, who's now moved to Australia. On the extreme right is our anesthetist, Dr. Ravin, who's seated at the back there. And what we did with patient optimization was we thought that, okay, if patients are slated for surgery in the next 2 to 3 weeks, why don't you bring them here to the clinic now? They can see Dr. Ravin. He can assess. We can determine if patients were okay, or fit, did they need any other investigations, etc. You had time to work them up and optimize them before they underwent surgery. And that practice we started in 2006. And it really did drop our preoperative admission days. Previously, because our OT list is always on Monday, so patients will be admitted on Thursday or Friday, and there's no home leave. So the patient will occupy the bed Thursday, Friday, Saturday, Sunday, 4 days before surgery, which I'm sure our management in PPUM here will tell you 4 days, that's really a waste, even back then. But with this protocol, we were able to cut short dramatically to only just the day before surgery that patients needed to be admitted. So this was in 2006. Currently, the NS clinic has opened the pre-anesthetic clinic, and that's opened in 2013, and all of our patients go through that system before they come for surgery. Now, it turns out, I don't know how many of you listened to Prof. Ong's talk last month when he talked about red dots and green dots. Yeah. So in essence, red and green dots are people you bump into throughout your life who are either good or bad for you. Okay. Red dots are, they bring you a lot of bad luck. Green dots bring you a lot of good luck. Dr. Ravin has been a big green dot for me, really. So thank you, Ravin, for your guidance. Even though we are from different specialties, there is no blood-brain barrier between us, right? Tak ada, okay. Why is Ravin a green dot for me? Because aside from being our anesthetist, one day he says, "Hey, Azlina, what are you doing for dinner next week?" I said, "Nothing. Come, you follow me for dinner." I said, "Okay." I went for dinner. It was in Eastin, if I'm not mistaken, and you had to register for dinner. And when you registered, he says, "Pay the girl 200 ringgit." I said, "For what?" and he made me the life member of Malaysian Association for the Study of Pain. He roped me into a pain society where soon after I became ex-scholar and whatever committee members. But being in that society really taught me a lot about pain. Because if you think about it, our patients, for orthopedic patients, they present to us in pain. They may be limping. If it's not painful, they won't come to look for us. The moment the limping becomes painful, then they will look for a surgeon, right? So understanding pain was pretty important, I think, for a surgeon. And at that time, not many surgeons were in that community, from what I understand. The MASP then sent me to the International Association for the Society, I think Pain Societies, where they had their first ever ASEAN pain camp, and it was based in Thailand. So you not only learn that pain you just treat with throwing medications or injections at patients, but you understand how pain works, how drugs work, and how other modalities can help you with pain. So that massage there is not on the side one, that is formal part of the curriculum. They took us to a massage place. You could have a whole body massage or a foot massage, just to show to you that massages would be one of the helpful measures for pain relief. So coming back from that, we embarked on how, because one of the complaints was pain. It's so painful, I don't want to go for surgery. Even here we get people who are in pain that are so scared to come and see surgeons, takut kena operate. Yeah, I'm looking at you. So, because to patients, pain always means bad things. It doesn't mean good things, right? Like I said, the one who limps without pain and suddenly got pain means, oh, there must be a problem, right? So, pain is always a negative connotation to it to our patients. So, what we started with was we started giving local anesthetic injections around knee replacements that we do, and this was around 2005, 2006, thereabouts. And even just by this measure with the standard medications that we gave already helped to dramatically improve patients' pain. We moved on to prescribing to patients oral analgesics. So now, as a standard, I tell patients who come for knee replacement, I'm going to give you 4 types of painkillers after surgery. And all of them go like, are you crazy? 4 drugs, my poor kidneys, it's so bad, I don't want to take so many medications. And usually for those patients, I will explain the analogy to them like this. Imagine you're in KL and you want to go to Penang. You can obviously drive, fly, take the train. If you're really desperate, you can swim up the Selat Malacca to Penang if you really wanted to. Now, if the highway was blocked off, you can take the plane. If the airport also shut down, you can take the train. Pain is like that. For your brain to receive the pain signal, it goes through many pathways. One drug may cover one pathway, but the other pathways are still open. And hence why our old style of treating pain, which is just giving 1 or 2 painkillers, was not effective at all, because it wasn't blocking off all the pathways. So as a standard practice now, we usually give about at least 3 to 4 different types of painkillers. The very macho patients say, no, I can tahan, until they cannot tahan. And the moment they take all their 4 drugs, they're pretty happy. So this also helped our post-op pain relief measures. We also introduced giving femoral nerve blocks, which is an injection of local anesthetic around a major nerve in the groin so that it will numb the knee after surgery. And we did a pretty short comparison study, although not statistically significant. It was obviously significant enough for the patients to have a bit more pain relief than the other side so that they can get out of bed faster and move faster. We also started to see and receive a lot of referrals for management of infections, which is one of the really dreaded complications of any surgery, not just arthroplasty. Some were ours, some were from outside. At one point, the highest infection rate for our unit was about 11%, which means that out of 100 patients who would have surgery, 10 to 11 of them would come in with infection. And that's not really good, because people want, after surgery, no complication, right? They want to go home, move about, and do whatever they want. So infection was a really big deal for us to try and tackle. Some of the early steps we took was trying to understand why patients grew certain bugs in their knees. And we did this study, although Prof. Sashila frowns on it. She said, that's not how you do knee swabs. but it was helpful for us at that time. It was before we met you. And it was helpful to us because one is, it kind of showed us what are some of the more common organisms you find on patient's skin. But what was really telling for us is almost 7% of the organisms you find are actually resistant. They will not respond to your standard antibiotic prophylaxis that you give during surgery. And so we had to figure out a way how to get rid of all those additional bugs. So we began instituting compulsory preoperative bathing with chlorhexidine for our patients. At the bottom right photo, the extreme itch was how we used to do dressings for our wounds. We changed that to advanced dressings where we don't need to open the plaster very often. So patients were very happy because, every time you peel off plaster, like all of you, I'm sure, felt that before, right? Every time you peel off plaster, very sakit. So, they were very happy that these plasters, we didn't really have to open very often. And we really made sure that people were strictly adhering to sterility protocols in OT. The big game changer for me when it came to infection was when I attended this conference in Prague in 2015. By that time, I was, not to sound very pretentious, but by that time, I had heard all the debates about arthroplasty. Yes, Prof. Hafiz, patella, do or don't do, keep the PCL or don't keep the PCL, this approach or that approach. But in this Congress, there was one room that was just dedicated to musculoskeletal infection, and I spent 2 days of that conference, the whole 2 days, sitting in that room. And I realized that outside of Malaysia, there were a lot of people working on musculoskeletal infections, figuring out, and these were not just infectious diseases consultants, these were orthopedic surgeons. So we knew that it was possible, that they would teach us things like, how do you diagnose, how do you prevent, how do you treat, and it really changed my approach to how we deal with patients with infection. My second game changer is actually meeting Prof. Sashila. So prior to that, no offense to all the other infectious diseases consultants, but prior to that, whenever we had infections and we would ask, for example, lots of antibiotics to put in bone cement, we will be blocked by certain powers that be because they say that's not how you use antibiotics. It's an abuse of the antibiotics. Meeting Prof. Sashila, she was very open to how we were doing it. She initially was skeptical, like, really, this is how you really do it. Show me the evidence. And when I did give her papers, she actually read it. You did, right? Yeah, okay. And she understood where we were coming from, and she said, okay, you got to go ahead. And really, when you have a partner, someone even from a different specialty, but understands where you're coming from and what you're trying to do, it really allows you to do so much more than you will if you were working on your own. My next game changer is still Ravin. You will be wondering why an anesthetist would be involved in infection. But actually, Ravin, I think there was somebody who had met him with regards to prevention of infection from the anesthesiologist's point of view. And they wanted to introduce something different. And he says, go see Azlina. She will help you. And this person then put me in touch with APSIC, the Asia Pacific Society of Infection Control, where I got to learn a lot more about how do you prevent surgical site infections. And we came up with these guidelines over 3 months. It involved 3 trips to Thailand, which was very good for me. But with these guidelines, which was published in 2019, it really was to help people understand what are the steps that you can take or do to prevent infections in your surgeries. And it's not only for orthopedics, it's for any surgical specialty. Based on these guidelines, we developed a safe surgery or SSI prevention program, which encouraged hospitals to join. And we as usual, macam Hunger Games, like you pit everyone against each other. So we were tasked to come up with various projects which looks at how we can optimize our SSI prevention protocols to reduce infection. And Prof. Sashila and I came up with this one, which was our quality improvement project, at looking at trying to reduce infections in closed lower limb fractures, which were operated on. What we found was there was no standardized protocol for SSI prevention in UMMC at this time, and this was in 2018, if I'm not mistaken, right? in 2018, still no SSI prevention protocols. And the infection control nurse was tasked to do an audit. And in that audit, we found that in the preceding 3 months, there were 23 cases, out of which 2 cases ended up with infections. So that gave you an infection rate of almost 9%. All right? So our quality improvement project was, let's target to reduce infection by 50%. We won't be so ambitious to reduce by 90%. Let's go at least for 50%. We just introduced 4 measures out of all the measures in the guidelines. Simple, easy for people to follow, because as you know, if your list is very long, nobody's going to read the second page, right? So, and it's only 4 things, and we improve communications between the team. Now, when we started this protocol, we did reduce the infection rate by more than 50% actually. And this quality improvement project of ours actually won our hospital the SSI Epsic Surgical Site Infection Safe Surgery Award. If you see it, it says 2019-2020, the conference is 2022. What happened in between? COVID, right? So we couldn't, and hence our celebration also semua berdiri pakai mask, ambil kek lari, and then go eat somewhere else. That's how we celebrated. And really was a teamwork. Again, teamwork, the team. Working together with other people, not just the anesthetists or the infection control departments. You work with pharmacy, you work with nursing, etc. And from that one protocol, we've now extended the bundle concept to other surgical departments and other surgical procedures. Now, Dr. Ravin's contact also put me in touch with Dr. Javad Parvizi, and he's the shorter gentleman on my left in the middle picture. So Dr. Parvizi runs with Thorsten Gerk, runs the International Consensus Meeting, and in 2018 they did the second consensus meeting on musculoskeletal infection. It is a by invitation only kind of meeting, so it's about 500 orthopedic surgeons, 2 of whom were from Malaysia, namely Prof. Chun and myself. All right, and since then, the document for ICM is openly available, and that's the QR code. When I came back from that, soon after, the Ministry of Health came calling. That's Dr. Faiza Henrid, of the Clinical Audit Unit of KKM, invited me, Prof. Sashila, to join their SSI Prevention Technical Work Group to also come up with guidelines and surveillance protocols for KKM. And this surveillance guideline came out in 2023, and we stopped being a technical working group. We are now a committee. Hopefully by the end of this year, we'll be able to come up with the results from the last 1 year. So to prevent SSI, really is multidisciplinary. Similar to multimodal pain relief, is all the little things bundled together that actually reduces infection dramatically. When you're treating infections, don't just simply, Prof. Sashila, this is for you, okay? Don't just simply throw antibiotics like tic-tacs to everybody. You need to find out what the organism is before you give, because one, you might not be able to be hitting the right organism with the right antibiotics. Number 2 is, if you don't know what it is, once the patient is on antibiotics, you do whatever testing, it's difficult to find out, what organism it is. Pass, Sashila? Can, huh? Okay, you're welcome. So the next thing we tried to fix was, or look at, was deep vein thrombosis, which is blood clots in the legs. Now, classically, people say that Asians don't get deep vein thrombosis, but a number of studies since have shown, especially the key study from our department, from UM actually, in 1996 by Prof. Dillon, showed that actually for patients who had hip and knee surgeries, the DVT rate can be as high as 60-something%. Right? The IDA study, which is more multinational, multi-centered, of which we were also a part of, quoted a slightly lower rate, still 40%, not low enough. So 40 to 60%, that's almost the same rate as people overseas. So we knew that with our patients with arthroplasty, after surgery, if we don't relieve their pain, we don't get them out of bed, they're at high risk for developing blood clots. So we were really incentivized to get them moving and to get their blood flowing. So with that, we managed to work with the Thai Hip and Knee Society as well as the ASEAN Arthroplasty Association. And over COVID period, we came out with the consensus document for venous thromboembolism. I had worked with the Thai Hip Knee Society and the AAA before because we came out with a textbook for arthroplasty, no longer in print, sorry guys. And soon after that, again, Dr. Pavizi invited, two of us to also be a part of the global guidelines for prevention of VTE consensus group meeting. So that's also open access, and you can search it online. Most of the patients that come for arthroplasty are generally older, and as surgeons, actually, you can feel when the bone is not so nice, when this is healthy young person's bone or not so healthy elderly patient's bone. This is a patient who was referred to us 2 weeks after she had surgery. She was not walking actually before surgery, and the surgeon over there did both knee replacements and told her walk. She tried to walk, she fell and broke both the knees. And unfortunately, we managed to save one, but the other one was an open fracture and became infected. It was so bad that even with the cement there, the bone kept fracturing around the cement. So we had to fuse the knee in the end. So that for me gave us an idea that, and with my group of friends, can we optimize patients' bone health before they even come for surgery? So we set up this society called My Bone. It's probably the first society in the world that looks at bone health optimization, and this is our paper, position paper that we published last year. And in it, really, bone health optimization is meant to remind surgeons that osteoporosis exists even if your patient doesn't present with osteoporosis. You need to be mindful. They were saying like the eyes will not see what the mind does not know. You need to have it always at the back of your mind. If you suspect it, look for it, treat it accordingly. If you need to, delay surgery so that you can get bone to be stronger. With all that in place, what else was there for us to do? To help us to reduce post-op problems. When I was head, I had the great privilege to meet Prof. Naha, who's hiding away over there because he didn't realize his photo would be up here. And really, when we got to talking, because all this while I thought sports medicine, sports only lah, right? Only young patients. But it turns out, he says, send your osteoarthritis patients to me lah. I can also help precondition them before they have surgery so that they can recover faster, they get out of bed faster, and what have you. So thank you, Prof. Naha, for volunteering your clinic so I can send my patients to you so you can help optimize them for op. And actually, with all these protocols in place, we managed to reduce post-operative hospital stay or total hospital stay. Previously, up to 2 weeks. Now, patients stay for less than a week. And we've also reduced our infection rates from 11% at one time to less than 2%, and with an infection rate of the actual implant of less than 1%. And all of this is actually within international standards. These are some of the patients that I have had the privilege to treat. Again, because you have good pain protocol, good education, patient understand what they're up to, you can get them out of bed like within hours. Okay? The bottom two photos are younger patients. So arthroplasty is not only done for older patients, but now with its great success, even younger patients are opting for it, especially those where they have end-stage joint damage. And I've been very privileged. My patients keep giving me food. So I'm very thankful for that. That's durians, I got cake, I get chocolates. It's really nice. So all set, right? We got everything settled. All of our patients got better and went home in days. But that's not the only thing, right? I have a few more years left in my career. I need to do something more, or else PPM will kick me out because you're not doing enough work. So we thought of other things of how we can improve our patients' arthroplasty experience. One of the first things we asked is, well, okay, we get them to go home in days. Can we get them to go home the same day, right? And that is when we introduced the daycare arthroplasty service for knee replacements in UMMC. We are probably the first public hospital in Malaysia that offers this service. I think others have followed suit after this. So with daycare arthroplasty, our patients come at 7:30 in the morning. They are fasted. They've already done their pre-op optimization in the clinic weeks before. They're fasted. They've already done their chlorhexidine bath. They know what they need to do. They have surgery and it finishes by 11 a.m. They recover for a while in the recovery area of the daycare OT. By 3 or 4 p.m., physiotherapist comes, get them out of bed, get them walking, 5 o'clock, balik rumah. It's for a select few, yes. I see a few interested, like the eyes blinkered a bit. But yeah, if you have to be really fit and good pain threshold, I think, for this. Now, one of the reasons we introduced this was really because we had a very long waiting list. In 2023, it was 2 years. Currently, it's 4. So, Prof. Nazi, Prof. Azura, I'm looking at you. After this, we can do something. Okay, because that's the next thing that we need to look at. How do we optimize our list? We already optimized the patient, but how do we optimize our list so that we can treat patients? Because I think patients waiting 4 years for a knee replacement or hip replacement is cruel, I think. We also started robotic surgery services in PPUM the same year. And with the ideal that we want better accuracy. Again, we've already optimized everything about the patient. How can we make ourselves better? And that's why we wanted to introduce robotic. The promise is obviously in the long term, we hope to have better implant survival. In this expert meeting that we had last year, again, about 400 surgeons from Malaysia were invited. The consensus still is it's too early to say robotic is the way to go, but it's looking positive. Okay, so don't give up on it yet. So I'm sure you notice in a lot of my pictures, like I'm the only woman there, right? I always make it an effort to wear some different color baju from the rest of the guys. So I don't wear white. So you can see red up there, you can see yellow here, big green. Okay? Because I think we need to be a pop of color in that sea of dark suits, right? So, so I find myself asking, where is everyone else? The ladies up there, actually the wives of the surgeons, and that's who I always, I get along with lah. Siapa lagi kan? And actually in Malaysia, out of the many orthopedic surgeons we have in Malaysia, 11% are women, and that's really good actually. We're pretty, up there. Malaysian Orthopedic Association has the honor of having 4 women presidents lead that association in the past. That is the most number of women presidents for a national society in the world. So Prof. Sarah is here, Prof. Ruhi is there. I think we've done a lot, but we have a lot more to do. And since then, I've also been involved with the women's chapter in College of Surgeons, and I also mentor for arthroplasty surgeons, women arthroplasty surgeons. And it's really not about, because when people talk about women's chapter, oh, you're just going to drive women in only, that's your only agenda. It's not. It's meant to promote diversity and equality. Everyone needs to be treated the same. You don't want, you don't know the feeling when you go for an interview and the only reason you did not get that spot is because you're a woman. That is not on. And I think that is so, maybe 100 years ago, I hope, and this is not the way we should go forwards. I also try to help out in the community. So I've volunteered twice for missions with Mercy Malaysia. First in 2005 was to Bagh in Pakistan when they had a major earthquake. It was my first time riding a helicopter, and we were working out of a hospital, which was a tent hospital, and that was all we had in terms of equipment and the anesthesia. I also had the privilege and honor to help in Gaza in 2009. At that time, I think it's really not as bad as what it is now. But certainly at that time, we were there to be able to offload the burden of the doctors who were there. We helped them do surgeries. We taught some of the medical students, and we were hosted very kindly by this Palestinian family who got me that jubah, which I still have at home. But nowadays, I spend most of my time in the community with Limbs for Life. And for that, I have to thank Angeline and Param sitting in front here for helping us run the Limbs for Life Prosthesis Center. So Limbs for Life is based in the Bandar Utama Buddhist Society building in Bandar Utama. And it is our mission to provide lower limb prosthetics for amputees, lower limb amputees, whether they are below knee amputees or above knee amputees, irrespective of age, race, religion, right? So we've had very young amputees, I think less than 10-year-old pun ada, and then as they grow, we have to keep changing their prosthetics. We have young ones like our gentleman, young man over here. He's a para-athlete. As you can see, he's cycling using our prosthetic limb. We have Pakcik over there who also lost his left leg and cycling happily, and every few months he comes to us because he took us spare part because he's worn out his limb. And we get double amputees as well. The key here is we want to give patients the dignity, their dignity back, their mobility back, their confidence back. So that and it's very heartwarming when they are fitted out the first time and they are able to stand for the first time in weeks, months, or even years, and they look at you and they say thank you. That is really really heartwarming for me. Now, you've heard about how I've learned so much, and it's great that I've learned so much, but it's not so great if I keep it to myself. So all the things that I've learned, we should try to always share it with others. And not only all the good things, we really do need to share even the failures that we have gone through. Because our students need to feel that we are not God, we are not perfect. They need to know that we are human. Right? It's nice to feel like as if you're on the pedestal, but actually they need to know that we are human, that we have suffered. My students who have been in classes with me are very well aware. I'm very open with the fact that I failed medical school like 2 years, every time fail. My A-levels also I failed, my part 1 also I failed, I had to repeat. All right? I had all those experiences. And it's really to give them some inspiration or motivation that just because you failed this time doesn't mean that's the end. You have to pick yourself up and you have to move on. I've had students fail before and they cry and they want to quit the program and go, why? Prof, I've never failed in my life before. And that's really sad because if you have never failed, then you would literally actually have never really learned. So I try to share that with my students, and that's why we've also tried to ingrain into our curriculum, whether it's undergraduate or postgraduate curriculum, that, you know, we are all human. It's not perfection we're looking for. If you're perfect, that's great. But if you're not so, also it's okay, as long as you're safe. And that's the really important one. Okay? And really, we have to do good by our students because they are going to be our doctors, our future doctors, or our future specialists and consultants. And actually, all doctors are leaders in their day-to-day practice. It's not about I am a head of department or head of unit. Just by virtue of you having the title doctor, medical doctor, makes you a leader already. If you imagine that you're in a resus, you're the only houseman in the ward, you're surrounded by nurses, who's the head of the resus? The house officer, because of the doctor title. All right, so don't think that I'm only just a houseman, I'm only just a junior doctor. You are a doctor, and therefore you are a leader by your own right. Now, to be a great leader, you must have had great teachers. And in fact, to be great teachers, you must have the same mindset as great leaders. Because a good teacher must be able to treat your students fairly, just like a good leader would. You need to be able to lead change, you're of good character. You know how to delegate equally, not semua bagi kat one person je, right? You're ethical in your practice. So great teachers actually must have the same mindset as great leaders. Okay? Now, if the teacher is the leader, yeah, lucky I don't look like that. If the teacher is the leader, the followers, because you cannot be a leader without followers, right? If you tak ada pengikut, then you're a leader of nothing, right? So if you are the leader, then your followers must be your students, okay? It's not putting people in place, but for teachers is to remind you that you are the role model for your students to follow, to emulate. And the relationship between leaders and their followers is actually pretty close. And for me as a teacher, I try to, as a teacher, not be like Master Shifu, because Master Shifu in Kung Fu Panda thought of Po as just another panda. He's not the dragon warrior. right? He's nobody. But when Master Shifu managed to accept that Po, the panda, the way to train him was through food lah and this and that, then he learned to accept Po's strengths, right? And as teachers, that's what we need to do to help our students. For students though, it's not just as simple as the teacher will tell me everything. There is many different types of followers, and that counts students as well. This is the talk that I always give in my Train the Trainers for adults, for the teachers. And a lot of people, when I tell them, okay, you just close your eyes, you imagine people that you worked with, as I describe them, see whether any of these people fit in your mind. So it's the same with students. Are you going to be the herd of sheep waiting for your lecturer to give you lecture notes, spoon feed you information? Or are you going to be the cynical student that no matter what, everything also nak complain? Itu tak cukup, ini tak cukup, not enough classes, not enough bedside teaching, not enough, right? Or are you going to be the empowered superstar where you look and make opportunities for yourself to learn? That different type of follower styles, one is the onus is on you to develop that. The onus is on us as leaders, as teachers, to promote so that we can get a galaxy of superstars rather than a herd of sheep graduating from University Malaya. Because, remember, all of them will be doctors one day, and doctors are leaders. But you cannot be a good leader if you have never been a good follower, right? So, on that note, I've been really fortunate to have given the privilege of many leadership roles, whether head of department, head of unit, president of the MOA, as well as now the chief editor of the Malaysian Orthopedic Journal. And really, I think that where we come from, we are shaped by our influencers. I'm using modern speak now, influencer. It's not just influencers, it's influencer. Even the negative ones, because you learn stuff from those that are not so nice to you, right? The positive ones are obviously good, they promote you, but the negative ones, you still learn from that. So in case you don't know who all these people are, of course in the center, at the top is my dad. I took this picture last month when I was in UKM giving a Train the Trainers talk, and they had this in the foyer. And they were very excited, so they wanted to take this photo. And at the bottom, of course, is my mom. Dad, because he shows me what it means to be a really good doctor. He was a GP. I used to follow him on his house calls and saw how a great doctor with good bedside skills will make the patients feel better even without medications. Mom, for the balance, because as you can see, she's the joker lah. Always not too serious, and she's the one that we can have fun with, literally. Poor thing always gonna bully by us. On your left, that is Professor Emeritus Dato Dr. Raymond Azman Ali, a neurologist from UKM. And you'll be wondering, well, she never went to UKM, so what's he doing there? I went to UKM as an elective student in 1996. And I spent a month with Prof. Raymond in his neurology clinic at the height of the mad cow disease. So thanks to him and his teaching, up to now, my husband will attest to this, I don't even take soup echo anymore. Because so scared, I still remember what Prof. Raymond said, all your prions, they travel in your spinal canal, soup echo. I was like, oh, after that, terus tak jadi already. So up to now, I don't drink soup echo already. But Prof. Raymond, that 1 month I spent with him, again, showing how with care, with empathy, communication with not only patients but also his students, how you can motivate people to do better. He was so inspirational, I actually thought I wanted to be a neurologist when I was in medical school. That was how inspirational he was. On your right, the top photo, of course, you've met Prof. Yoon. Next to him is Dr. Jamal Azmi. I credit him as the one who really opened my eyes to orthopedics. I think he was one of the main drivers that allowed me to do more than just be a houseman in UM. And I think as consultants in UMMC, when you are faced with junior doctors who are actually fairly capable, if you think they can do it, just let them do more. Trust them and allow them to grow, of course, under your guidance, okay? And of course, you know of Prof. Chun below. So with that, I'd like to say thank you. I'm almost on time. Thank you to University Malaya, to the faculty, to the hospitals, UMMC and SC, and of course to Nosra and Department of Orthopedic Surgery, one, for taking me in, number two, for giving me all these opportunities to grow, for trusting me, though you may sometimes wonder why, for allowing me to build resilience and allowing me to explore my creativity and go a little crazy sometimes. I'd like to thank also to Professor Datuk Dr. April Kamila Rosani for not taking no for an answer. She asked me 3 times, I think, whether I would take this job, and I said no, 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 and finally I said yes because she wouldn't let me go. But it's thanks to this job that I'm able to do what I do here in the faculty and support Prof Yang, our dean, and the other management team. Thanks, of course, to not just Prof Azwan and Prof Ramesh as top management in University Malaya, but also all of my colleagues in the Faculty of Medicine for your support. Thank you to Aizat and everyone in VicForm, as well as Department of Orthopedic Surgery for organizing and ushering. I think they deserve a round of applause for helping out today. But also thank you to my pembangunan team. Prof Ramesh was very kind because he says, oh, I get projects moving. What he didn't tell you is what projects I do. And those of you who know, that is mainly toilet. My husband asked me this. When I said development, he goes, what is that? I said, oh, it's toilet and parking, in short. And he says, oh, you won't last a year. So I have lasted a bit more than a year. So thank God for that. And I have lasted this long really because of the great team that we have working here in FOM. Great support. Yes, we are human, we do make mistakes, but we do our best to try and keep the building standing. But more importantly, I would like to thank my family, my parents, my husband, my son, my siblings. And on your right, no, those are not all ours, but those are the ladies who help to take care of my son while we are at work. If it weren't for them, I won't be here doing what I'm doing here now. So I would like to thank, this is not their real names, Auntie Momo, Auntie Bobo, Auntie JJ, and Nekmi. These are names my son gave to them, okay? Because if it weren't for them, I don't think I'll be able to stand here. So wrapping up, looking back in all my years, life is a journey with problems to solve and lessons to learn, but most of all, experiences to enjoy. And I think so far I've had really, really great experiences. I've learned how to scuba dive. That's how I met my husband. I've danced with fake Elvis in the middle. I've even driven a car with Michael Schumacher at the back. Yeah, we were on the way to F1 in Sepang, and we were at the Masjid roundabout when he drove up next to us. And everyone in the car was freaking, oh my God, Michael Schumacher. And I didn't realize, and I drove, and he was behind me for a stretch. We have no photos because everyone was freaking out. The one sitting in front was screaming, where's the camera? Where's the camera? The one at the back is gawking at the windscreen like, oh, Schumacher. And I'm like, guys, where's the camera? I'm driving. I was a very good Malaysian driver. I made way for him to go. All right. So that was really an experience for me to have. And actually, all those experiences, you can only enjoy them if you're with friends and family and people that you love. So with that, thank you very much for this opportunity, and thank you for listening.
Thank you very much, Professor Dr. Azlina Amir Abbas, for your very inspiring lecture. Ladies and gentlemen, I would like to invite Professor Insinyur Dr. Ramesh back to the podium to summarize and conclude today's inaugural lecture.
Okay, thank you. Yeah, Prof. Azlina, a lot of stories. All right, so we hear you, and there's a lot of things now we know about you and what you have done, over the past 20-odd years. And, I sat there, and I didn't want to sit up here because I don't want people looking at me, so I thought that it's best to sit down there. But I think you had, illustrious career, and I'm sure that you will, continue to contribute, and you only can retire if we tell you to retire. Okay, so so don't think that another 3 years or 4 years and that's the end of you. And I just want to add, you talk about leaders, and I think you are a good leader, and I think what you try to do from the very time I got to know you, I think you try to bring the best out of people, and I think that's what true leadership is. Rather than looking at, whether someone has a flaw and so on, but you look at the opposite. So I think that's really great. So to wrap up, I think we have just witnessed an insightful and thought-provoking lecture by Professor Dr. Azlina Amir Abbas on advancing excellence in hip and knee arthroplasty, innovations and best practices. Her presentation has not only deepened our understanding on the latest advancement of hip and knee replacement surgery, but also highlighting the crucial role of innovation, research, and clinical expertise in improving patients' outcomes. Her commitment to excellence in orthopedics, pioneering new surgical techniques, and shaping the future of medical education is truly inspiring. Through her leadership and dedication, she continues to push the boundaries of what is possible in the field of joint replacement surgery, ensuring that remains at the forefront of medical advancement. On behalf of everyone here, I would like to extend our heartfelt gratitude to Professor Azlina for sharing her expertise and valuable insights with us today. We look forward to seeing more of her impactful contribution in the future. Thank you, Prof. Azlina.
Thank you, Prof. Insignio Dr. Ramesh, for chairing this inaugural lecture today. And thank you, Professor Dr. Azlina Amir Abbas, for your very impressive and stimulating lecture. Ladies and gentlemen, this concludes our event for today. Thank you for sharing this remarkable moment with Professor Dr. Azlina Amir Abbas. To commemorate today's event, we'll be having photography session with Professor Dr. Azlina Amir Abbas. First, I would like to invite Professor Dr. Azlina Amir Abbas and Professor Insignio Dr. Ramesh to take a photograph. Oh, done already. Okay. Oops. Finally, a big group photo with Prof. Ramesh and with Prof. Dr. Azlina Amir Abbas to join the audience for photo thinking. Yeah. Could everyone please stand up and go towards the center? I would like to invite the audience to Center Point for some refreshments. Thank you once again and have a good evening and stay safe. If anyone else wants to take a photo with Prof. Azlina, please can stay behind for photo session.